don't be so hard on yourself. So whatever you want to do, you can make that into a business, but everything has to come with a price, right? Consistency is the price that you have to pay. So no matter whatever you want to do, be consistent at it, but never lose hope and don't be so hard on yourself.
Hi, everyone. Welcome to MDF Instruments Crafting Wellness Podcast.
My name's Sier. I'm a 24-year-old nursing student and I go to the University of San Francisco.
How far along are you in school right now?
So I just finished my fifth semester out of six. So hopefully I'll be done in 4 months.
So one more semester left.
One more semester, yeah, final
Okay.
stretch.
So you finish the final stretch and then you take the NCLEX. Is that
And
how?
then I take the big NCLEX, yeah.
So have you decided or planned out a little bit, started studying, or are you just going to get through the last semester and then start studying?
So my school, there's some schools that require a exit HESI, in order for you to be able to take the NCLEX. So I technically have to pass the exit HESI in order to graduate, then be able to take the NCLEX. So I have to get over that hump first, and then once I get over that, then I'll be able to then put my focuses on the NCLEX.
So can you tell us a little bit about a HESI?
Some schools require a HESI to get into the nursing program, to see your score and stuff like that. It's also called, there's another one called the TEAS exam. A lot of people are familiar with that you have to take that. And then depending on your score, certain schools will decide if they want you or not. The exit HESI is something to make sure that it's to prepare you for the NCLEX. So certain schools, like I know my schools are private, but I think it's mostly privates that do this. But they require you to take the exit HESI and show that you have this score, and that's going to show that you're most likely going to pass the NCLEX. So it's kind of for their
Oh
confirmation.
yeah, that makes sense. Like they did their job, they trained
Yeah,
you
yeah, pretty
properly,
much.
they gave you the
Yeah,
knowledge you needed to go on and succeed after you finish. Tell me a
yeah.
little bit about like what nursing school's been like for you. There's a lot of different avenues people can take to get into nursing, or what kind of specialty they want to be in, or just what kind of career path they want to go down. Have you thought at all about a specialty you want to get into, or what life looks like down the line for you as far as your career, or are you kind of just still feeling everything out?
I started college and I was gonna do 2 years of business because I also do like graphic design and stuff like that. But my sister got her degree in pharmacy, and I was kind of like interested because she was watching Grey's Anatomy, and I was all like, I started watching it. I was like, this seems like very interesting. Like I would love to like get into this field. So I decided to volunteer at a hospital. It's called Sutter, and then I was in the emergency department. So my first day as a volunteer, there's someone who came in with a trauma, a GSW, a gunshot wound. And it was my first day there. So like I'm there in the corner as a volunteer watching a doctor do like an open chest tube just like to save this man's life, and I'm just there and I see all the nurses, helping out, and the guy was when he came in, he was like, I have this new daughter, blah blah blah, like, please save me. And I was just like, okay, this is awesome. Like you get to help this person, right? But then at the same time, I'm also like, okay, if I'm watching this, am I able to, like, some people get nauseated with blood or seeing stuff like that. So I'm there, like, if I can handle this, I might be able to actually, do this. Watching this all happen, in that moment, I told myself, this is it. This is what I've been looking for. Well, I was born in California, but my family's from Afghanistan. So it's like a war-torn country, you
Mm.
know. So I kind of, they put so much effort into bringing me and my sister into a better place to get better schooling and stuff like that. So I was all like, it's a win-win. I get to help other people and do something with this opportunity. And why not do it? Why not go ahead and pursue something that I find interesting and that I can help other people? So um, I'm thinking ER maybe, but the emergency department, emergency room. So I think that's the path I might go into, but I'm still open minded.
It's so interesting how, you know, we just like go along life sometimes and then we just get an inkling to go do something, and then that can sometimes lead us down this whole other rabbit hole of passions that we didn't even really know that we had.
Yeah.
It just goes to show you when you have that little voice inside and something sparks you and you go, "That's really interesting," or "I wanna know more about that." You should always follow that kind of instinct in you because it just leads you down to more where you're supposed to be going with your life, I think. When you volunteered, at what capacity were you? Obviously, you weren't in healthcare at that time. So, what kind of things were you doing as a volunteer for people who maybe
Yeah.
want to go start doing that?
So when I was volunteering, it was like mostly restocking stuff. I would maybe bring water to the patients, sometimes, maybe get something from the supply room for a nurse. Mostly just like restocking, helping patients to the room and stuff like that. But the hospital that I was at, Sutter, they're so like they let the volunteers a little bit more like experience, get more exposure. So they'll let you in the room when stuff is occurring. So like there's other hospitals that will just like let you just do paperwork and you don't get any experience at all. So I would say really like talk to people who volunteer in certain places, see what their experience is like, and if they have a good experience and they get better exposure, maybe that might be the hospital to look at. But also, I do also want to say is like you said earlier, like whatever intuition you have or whatever, like it's good to like follow that. I think if you don't know what you want to do, like especially like I was just business, but I went in to go volunteer to see if it was right for me. So whatever anybody feels like you feel like something might be right for you, go volunteer, find an internship, and then you can make your decision on whether if this is for you or not. So that's like the best way. So
Yeah, that's great advice. I love that. So, did you actually end up going and getting your BA in business, or did you just kind of change
no,
from there?
yeah, so I switched. So I did 2 years. I've always been a full-time student. I graduated high school in 2016, so it's been a few years now. But I did 2 years full-time student, ready to transfer, and then I was all like, "Oh, nursing." And then nursing has prerequisites, so I did another 2 years of nursing prerequisites. So that's 4 years in community college, and then I transferred over, so now I'm in my 2nd year of nursing.
Love that. I love that you can just find the different paths to however you want to get there. You don't have to know right now when they're younger, like, I want to do this and do this and do this all in a linear way. You can start something and then it's better to start and then stop and say, no, business, not for me. Maybe I need to go down this route a little bit. Just want to kind of just dive into what people can expect and at what semester are you going in and like having patients and having those interactions. When does that kind of start?
Right.
And just what people to expect during the journey of nursing school. Like, I think sometimes people in their minds think, oh, I'm just like learning from a book, I'm studying, and then I'm learning and I'm taking tests and stuff. But obviously, there's a practical bedside part to nursing. So I would love
Yeah.
to hear about that a little bit.
So coming into nursing school, didn't really know what to expect. I realized they make you get white scrubs at first. It doesn't really make sense, right? You can get all types of stuff on you, right? And it's gonna show, right? The whole point of scrubs is also to also like cover up or whatever, not make it look super noticeable that you got stuff on you. But anyways, yeah, so we get white scrubs, and your first semester in nursing school, especially mine, was kind of you do CNA work, which is definitely needed. It's something that I think everybody is like, anyone who gets into the healthcare field or whatever, especially like nursing, or even if you want to become a doctor, like being a CNA, it teaches you a lot. You're there with the patient. You're doing everything for the patient, helping them clean themselves up at their lowest point. It teaches you a lot about yourself just as much too. So, but yeah. So you're following the CNA. You're doing a lot of shadowing. You're helping them out with whatever they need. Moving the patient from a side, helping them. Wash the patient, doing hygiene care. That's kind of what you can expect your first semester. Second semester is a little bit more hands-on, But in this scenario, this story, it was my first semester. Um, so there's call lights that you can go answer. I heard I had a patient, I heard a call light, so I went to go into the room, and he's like, I need to use the restroom. I'm like, okay, well, he's able to move and walk to the restroom, but like, you know when he has to go, this patient has to go. So I try to like, I'm holding his hand, we're going, and he's like, it's coming. I'm like, in my head, I'm like, what? Like, like we're like a few feet away, and we're right next to the restroom. It just happens. He just like misses it, but then we still make it to the restroom. We still make it to the toilet, but he misses it, and he looks at me. He's like, "It's a bad day to wear white scrubs," huh? And I'm just like in shock, and I'm just like, "Man, like this guy did not really just clown on me right now. Like he like you know." He came at me. I'm trying to help you, sir, and he's just like he makes something light out of it. I was just, I don't know. I was just like at that moment, white scrubs have to go. Imagine if I did get it on myself.
Yeah, but like white is terrible. Like anyone who's had, sneakers or just like anything, you can't you know that it's gonna get dirty way easier just
Yeah.
eating. And in healthcare, you're talking, there's all kinds of fluids you're dealing with. Blood and pus and urine and feces and like vomit. I mean everything, right? So white seems like a terrible idea.
Yeah, but recently, so for my school, we had a student. Well, we have three guys in my class. One of the guys, he was wearing all white scrubs, and one of the teacher noticed what his boxer briefs were see through, and at that moment they're all like, all right, we're changing the colors. So we wear white tops, but now green bottoms.
How big is your class? Because you said there's three other guys. So is there four of you total? Is it just predominantly female?
It
Yeah.
is. So for my school, my cohort, my program is kind of small, total of like 20 people in a cohort. So each semester you're with those same 20 people until you graduate. Also, we have our clinicals. We have split. So clinicals, for what you get, if some people that don't know what clinicals are, it's kind of, you're going to go shadow the nurse and getting your experience throughout nursing school. So our cohort splits it, so not everyone's at the hospital at the same time. So there's a Wednesday group and a Friday group, and I'm on the Friday group. I'm the only male in the Friday group. So all the males are on the Wednesday group. I know I've posted some pictures on social media, and some people are like, "Oh, you're like the only male there." Well, I mean, there's more, but in my group, in my Friday group, I'm just like the only male. So yeah.
I feel like more and more men are coming into nursing. And that's actually how I personally have an affinity for nurses. So when I was like 20 years old, I got adjusted by a chiropractor incorrectly. And he did something where basically I didn't get blood to my brain. And so I passed out and I peed myself and I lost vitals and I woke up in an ambulance and went to the emergency room. And I was in California all by myself and didn't have any family or anything there, no friends, nothing. And I was so scared because I didn't know what had happened to me. I was just very alone and afraid. And I had a male nurse who he like put socks on my feet because I was cold and like took care of me and made me feel so safe that like when I got released and like a week later, I wrote a thank you note and like dropped it off at the hospital just to let him know like how much that he meant to me. And it's not like a male or female thing, it's just a nurse thing. And I was like, wow, nurses are amazing. And he really went that extra mile. But I've been to the doctor a lot and I don't see very many nurses. Can we call you nurses? I don't know.
Yeah, yeah, yeah.
But I'm really happy to see that it does seem to be growing. It does seem to be like, 4 out of 20. Okay, we can get those numbers up. I know that you're going to be a great nurse no matter what specialty you get into, but it sounds like emergency room medicine might be for you. But I do have a warning. I have talked to a lot of people who, when you get into emergency room medicine, night shift, that night shift is a thing. You have to start out. Are you a night owl?
I am a night owl, yeah,
That's good. Because I hear, like, when you first start out, you have to do, a lot
night
of
shift.
nights. Yeah, a lot of night shifts.
Yeah, I mean, I do photography and I cut hair, but like photography, editing photos, some depending with my school schedule, I might stay up to like 4 a.m. editing photos. So yeah, like being a night owl is kind of
That's awesome. I
something
would love to
good.
hear a little bit more about that. Okay, so you cut hair and
Yeah,
do photography. Let's talk a little bit about your passions. How did you come into this? Like, what was any stories there?
I had just got an internship at Apple in my senior year of high school. So I had money saved up and I my friend would always cut my hair. The internship ends and I need to look for a job. What can I do to manage school and have hours that I need for myself and then the rest that can go to school and and work. So I just paid $500 for equipment and I just went in full at it because I already found interest in it. So my thing was if I'm going to put money into this, I need to make this money back, right? So I did that. I used to get practice. I used to drive somebody at 30 minutes, pick him up, bring him back to my house, cut his hair, and then drive him 30 minutes back for free. I didn't charge him or anything, but that's what I needed to do to learn, right? So you have to do what you got to do to learn. It was an investment from myself, and now I have an appointment on my website, and people book them, and I cut 1 day a week, Saturday from 9 to 3. That's enough to keep me busy for the whole week, and gas or whatever I need to do, and it's maybe a few people throughout the week. Photography, I did graphic design since middle school, and then I got into high school. I did yearbook, and then I had birthday money saved up, and I used all my birthday money for a camera. And then from there on out, it just slowly, as the years progressed, got into more photography, and yeah, hopefully slowly going into maybe weddings and like party events and stuff like that. It's a lot of creativity combined, but I'm able to choose my hours and do nursing at the same time and have enough time to study. So that's what was most important to me is doing stuff, but I'm able to focus on school.
Yeah, well, you have amazing hair too, so that doesn't hurt.
Thank you.
You know
I
what I
just a little
mean?
wild. I need a
I love
haircut, but yeah.
it. No, it's funny, as I talk to more and more healthcare people, everyone has a creative outlet because I think to be drawn into healthcare, especially nursing, you have to have a certain kind of empathy and certain kind of heart that leads you to want to help people, be there for them, sacrifice, your holidays with your families. And, nursing is not for the faint of heart. So I think there certain kind of people are drawn to that, but that is in alignment with creativity. And it's great to have other outlets outside of nursing to be able to kind of express yourself. But it's really interesting because everyone I talk to, like especially nurses, they all have some sort of creative outlet, whether it's like writing poetry or drawing or acting or whatever it is, photography. It's very interesting because I just think that it kind of shows that there's this certain kind of person that goes into
Yeah.
care that is also kind of an empathetic type of person, expressive, creative. And who knows, maybe you'll be able to combine all of this. You'll be like the nurse that's helping out in the emergency room, and then someone's in the ICU for a week or two and they need a haircut. You can just
Hey,
do
there
the
you
haircut.
go.
You could do like before and after photo, like makeover style.
Yeah.
If you could tell your younger self anything, like advice or I wish I had known this, what do you have any kind of advice or what would that be?
Yeah, I think it would be don't be so hard on yourself. I was in high school, just always stressed about like what is my career going to be? When am I gonna find what is for me? And I wasn't always the best in high school. Like, I mean, I would get A's, B's, and C's, but they weren't straight A's. I would always have a creative outlet, do creative things, but I never felt like there was any worth in that until becoming older and seeing, businesses needing certain stuff, other people, there's needs for anything. So whatever you want to do, you can make that into a business. People want to play video games their whole life. That's totally fine. You can go on Twitch and stream it. You can be a, Twitch streamer. You can, but everything has to come with a price, right? Consistency is the price that you have to pay. So no matter whatever you want to do, be consistent at it, but never lose hope and don't be so hard on yourself.
That's really great advice. I think consistency is the key. I always try to tell myself that, when you get discouraged or something's not turning out the way that you wanted, or you're still trying to learn something, you're going to fail a lot before you get to the place that you want to get to. But you just have to keep showing up. You have to keep trying and you have to keep showing up. And even if you wanted to be a video gamer and do Twitch, like you might only have one person watch for a week or two, and then but you have to keep showing up, keep creating the content.
If it was easy, everyone would do it. So it's not, right? So there's always a select few. Everyone's watching other people and be like, I wish I was like him, but they don't know what that person went through to get to that position, right? So
Yeah, and I love that you're showing like an entrepreneurial spirit and also just showing you're thinking outside the box, that you don't just have to be one thing. You don't just have to be a nurse. Like you can be a nurse and you can also be a barber and you can do photography, and you can be we're all multifaceted. So you can be more than just one thing. One certain focus doesn't have to take your entire life. Um,
yeah.
I was talking to like a travel nurse before where they kind of were like, well, I really wanted to travel and have adventure. And so I combined my love for helping people with my sense of adventure. And then, voila, there you go. So I think
Yeah.
it's important for people listening and watching to just remember that you can think outside the box. You don't have to do something one way. There's a lot of different ways you can do it. And also you can pursue multiple things at the same time.
For me, it wasn't I didn't learn barbering and photography both together. It was 1 year, it was one focus there and then another year that focus there. So, don't over anyone who's trying to do multiple things, don't overwhelm yourself. Just make sure you give yourself time for one thing to at least learn it, and then, learn another thing. So,
Yeah, you
as long
really
as you can,
committed. You spent
exactly.
money, you needed to learn. So then you understood, okay, well, I'm gonna have to, if I really want to be good at cutting hair and I want eventually people to pay me to do this, then I'm going to have to make sacrifices to learn this skill and learn this craft. So I'm gonna have to offer to cut people's hair for free. It's probably the same with photography. Like, okay,
Yeah.
can I take your picture for free? I need to work on, like, I want to make headshots or I want to do this kind of photography. Can I come to your wedding and just be an extra photographer? And then as your work gets better and people start to see, and then you get word of mouth, and then eventually you start to make money doing it, but you can't always do that right out the gate. But I
There
love
you
the
go.
commitment that you have where you're like, I'm in this 100%. Like, now I need to make it pay me back. And I think that's the kind of gung-ho, like spitfireness you need to pursue really anything. You can't really half-ass your way through stuff. It's just you're not going to be successful at it.
Exactly.
Any other fun stories in nursing school, or things that you thought were going to be different than like expectations versus reality?
During going into nursing school, I didn't know exactly what to expect. I thought everything was going to be structured properly, but going into clinicals, you realize quick that it's kind of a mess. A lot of nurses got to figure stuff out on their own. It's everything's not pretty straightforward, and there's a lot of, like you said, there's a lot of creative nurses. There's a lot of creativity that goes on behind, just being a nurse, coming up with, what works for you, making sure time management, pay and managing different many patients and what they need, what their needs are, right? So there's a lot of um there's a lot of that that's going on. I thought there was a big backbone for nurses, but it's really not. Nurses are the backbone themselves. They take on all the pressure, and at the end of the day, trying to lift up their patient. I started off doing med surge. Med surge is like, and I know in some places like East Coast, they might have up to 8 patients. In California, from my understanding, I think it's up to 5. It can get crazy. You have to, make sure you give everyone's a medication on time. and then also making sure whatever whatever needs they have, they get addressed as well. And sometimes you'll be behind, and that got overwhelming for me because that's not something I experienced as a volunteer. I was only a volunteer, right? And then I never got to experience really the back end of things.
Mhm.
But as I got into further into nursing, I just had labor and delivery OB section of my semester, the my fifth semester, and I got to be at the NICU with the babies, and that was nice. I mean, some of the nurses might take care of one baby depending on how sick they are, and then max up to three. And it was my first experience with ICU. And nurses will either have one to two patients in the ICU, but never really five. So there's different types of nursing, different it works for everyone differently. Some people are able to do time management and take care of all that and be cool with all that stress. Every nursing position can be stressful, but it's what works for you. And I was just overwhelmed because my first year was pretty much just all med surge, and I was all like, "There's no way this is just nursing." Like I went from experiencing like emergency medicine, and then going into med surge and thinking like, "This is just what nursing is, and this is what I just have to accept that." But then going to different specialties is, I'm like, okay, whew, there's different stuff for me that I can venture off to, and I'll be fine, and I'll enjoy, and I can like be cool with and just learn a lot of. So
Yeah, that's really awesome that you get to kind of dive into the different specialties and kind of it helps you decide what you like, where your passion really is. Because, like we were talking about, there's so many different ways to be a nurse, so many different
avenues,
specialties you
yeah,
can
different
go into.
departments, and
Yeah, so it's like maybe med surg isn't for you, but maybe something else is more your speed. But also what you're talking about is, something that we talk a lot about, which is safe, staff patient ratios and making sure that our healthcare workers aren't overwhelmed with having so many patients that they can't give the proper care that they want to give because there's only so much time in a day and so much shift to do and so much there's just it's impossible. So I know in California, I think that they passed a law where you're only allowed to have a certain number of patients per nurse, but it's
Mhm.
not like that throughout the whole country yet. Other
Exactly.
states have to follow suit, but it's definitely a fight that we're on board with and, trying to make sure that you guys are protected and safe as well. Because at the end of the day, if you make a mistake, even though the hospital didn't staff you appropriately with a number of patients, at the end of the day, the hospital is going to blame the nurse. And that was true with that woman who,
The Redonda
yeah.
case,
And it's like,
the
well,
medication error, which was predominantly it was a system, it was a hospital system problem, but
yeah, but when you're up
blamed it on the
against a
nurse.
hospital and you're just a nurse, you're one person,
You're a
that's the whole,
human.
yeah,
That's you're not like you're a human
yeah.
being taking care of other human beings. There's mistakes bound to happen,
Mhm.
and you can only do so much, like other people who don't go into the profession, they don't get to experience what, other nurses go through, and it gets overwhelming, gets difficult, but at the end of the day, you're human, right? So it's just like the hospitals should be looking out for the nurse's best interest because at the end of the day, there's
Yeah.
without healthcare, without staff, without nurses, no one's taking care of the patients.
Exactly. And you're also like you're having to work under pressure, especially in an emergency room situation. There's a lot going on. So we got to help our healthcare workers by making sure that nurses are protected and they aren't overwhelmed as much as we can help them not be overwhelmed because it's already an overwhelming job. But
Yeah.
we can do things like make sure that we have safe patient staff ratios. Well, Sier, I want to make sure I get your social media handles for anybody who wants to come follow you, check out your journey in nursing school. He's got one more semester left, and he's going to be doing, I'm sure he'll be doing lots of posts on the NCLEX and how he's studying for it. So, would you mind giving us those?
Yeah, so my Instagram, and you can find me on TikTok as well. It's actual art, so it's ACTUAL, actual, and then art, ART. and you just search that up, I should pop up.
Yes, he has all kinds of amazing content. You guys have to check it out. He's telling fun stories, he's doing dances, he's he's doing all kinds of fun stuff. Advice.
Yeah, I try to diversify it. So
Yeah,
if you guys, need any advice, hit me in the DMs. I will try my best to answer and, be the best resource of information for you guys.
thank you so much for joining our Crafting Wellness podcast.